Assalamualaikum, Madam Hasmiza. Today, my friends and I will present to you about Psychological Skills Training, PST. So, let me introduce myself first. My name is Nur Alia Kristina binti Izul Izam. I am 19 years old from Kuala Lumpur. I love to cook and bake. However, I hate to jogging because I am lazy. My major sport is softball.
Hi, my name is Alif Nur Ilman bin Zamri. I am 19 years old and I am from Selangor. Okay, my advantages is soft-hearted person and my disadvantages is easy to cry. So my major sport is football.
My name is Najah Hayati binti Muhammad Zahid. I'm from Seremban Negeri Sembilan and my major sport is track and field.
Hi, my name is Anisha Fira binti Abdul Harid. I am 19 years old. I'm also from Seremban Negeri Sembilan and my major sport is a volleyballer.
So let's proceed to our first topic, which is self-talk. Do you know what is self-talk is? Self-talk is your internal dialogue, which is the conversation in your mind that influence your thoughts, emotions, beliefs, questions, and ideas. There are two types of self-talk. The first one, positive self-talk, and second one is negative self-talk. So, positive self-talk can encourage you and motivate you to do something. It also can guide you to make decisions and can help you to tackle your everyday challenges. For example, you say to yourself, yes, I can do this. I believe in myself that I can complete my task by today. However, negative self-talk is vice versa with the positive self-talk. It can lead you to distressing, upset, because it distort you from the positive outlook because you keep thinking about the negative thoughts. For example, you say to yourself that, no, I can do this. I do not believe in myself. I can complete my task by today. So next, there are four types of negative self-talks. First one, personalizing, which is you see yourself as the cause of all the bad things, which means you self-blaming yourself. All the mistakes, you assume that it is all your fault. Secondly, magnifying, where you focus negative information and ignore the positive information. For example, for this week, you gain 2 kilograms. However, you forget that you have lost 10 kgs for the last 2 months. Thirdly, catastrophizing, which you expect the worst and rarely let your logic or reason persuade you. For example, you fail a test and you assume that that will be a total failure in your life, which is that is the end. There's no chances in your life. And lastly, polarizing, which you see the world in black and white or good and bad, which means there is nothing in between and no middle ground for processing and categorizing life events. For example, either you are on diet or not, you does not feel good about your body or yourself. So let's talk about the benefits of positive self-talk for our physical and mental health. Firstly, it can help you to less stressed and less depressed. It can reduce risk of death. You will have better physical well-being. It can reduce pain, improve your immune function. You will also have greater life satisfaction because you will be happy. It will increase your vitality and reduce your anxiety or panic attack because you can think logically and rationally. Also, it can help you to cope better skills during pressure or everyday challenges. Next, moving on to the ways to practice positive self-talk. Firstly, you have to set realistic goals of what you want to achieve. Secondly, you must distance yourself from negative people and surround yourself with positive people. Don't ever compare yourself to others, which is you self-downgrading yourself, and you must believe in your capacity and capability to succeed. Also, give yourself to change and don't get stuck in the past. Be intentional with your criticism of yourself and give yourself positive affirmation. For example, like, you are clever, Alia, you can do this. And don't ever fear failure. Also, you must visualize your success. For example, for this semester, I want to get Dean List. Lastly, we look at the power of deep breathing for well-being. There are many benefits that we can get from deep breathing. Firstly, it can reduce anxiety and depression. Secondly, improve your psychological and physiological stress. Thirdly, reduce heart rate and high blood pressure. Fourth, increase calmness. And lastly, it can improve athletes' performance. So, how is the method and the techniques of correct deep breathing? Firstly, you must to breathe in slowly through your nose for 4 seconds and then pause for a second at the end of the inhalation and then slowly exhale through your mouth for 4 seconds and pause it. And do it repeatedly. So next,
Okay, so we move to the next slide, which is how to evaluate imagery ability. So how to evaluate imagery ability? By doing imagery script. So this is the example of imagery script. So try to imagine yourself to kick the ball directly to the goalkeeper. And if there is any sensory component to that, can you feel the way it feels like uh, you feel kick the ball to the goalkeeper as you do that? Just notice how you imagine the things most easily without judgment and without grading yourself. This is simply an exploration to notice how your imagination works. Move to the next slide. So how to practice imagery in football sport? So first of all, you need to practice frequently. So imagery is a skills just like any skills that you need to perform in sports. So you have to perform frequently in order to be perfect. So for the second point is um, emphasize on quality, not quantity. So imagery is a mental skill. So you need to concentrate and controlling your image, which can be tiring when you first get started. For this reason, it is the best for you to begin your imagery training by imagine a high quality image for the short period of time. So for the third point, set the scene. Try to make your imagery as realistic as possible by recreating important details of your sport setting, such as practice and competition venues in your mind's eye. So by including the colors, shirt of opponent, and the sounds of spectators cheering, you will feel like you are really experiencing the performance that you are imagining. And the last point is plan your imagery. Imagery of your sports, image of your sports can frequently pop up into your mind. But in order to get benefit from imagery training, you should plan the content of your imagery in order to meet your current needs. So here is few some examples in football sports. So if you are struggling to perform a certain skills or strategy in a game situation, you should try to imagine yourself performing skills or a strategy that you could not do in the real game. For example, you have a difficulty in dribbling a keeper when it comes one by one. So try to imagine yourself to dribbling the keeper and make a score. And then if you often let a distraction get into your mind, try to imagine yourself to be focused and relaxed in the presence of those distractions. For example, if you are always distracted by the crowd, so trying to imagine that you are in a stadium with a thousand of spectators. So with this kind of imagination, you will decrease the distraction, the distraction that you will feel. So for the last one, if you have a problem to handling your nerve in the competition, trying to imagine yourself performing exactly the way you want to under this condition that normally would make you nerve. So for example, if you are always nerve during a penalty kick, try to imagine yourself taking a penalty kick in those time that make you nerve. So it will decrease your nerve and you will confidently take that penalty kick. Okay, we move to the next slide.
Okay, next slide is about anxiety. Anxiety defined as the negative emotional state in which a person experiences a combination of nervousness, worry, and fear. So let's move to next slide. Okay, there are a few ways to evaluate anxiety level. Firstly, through questionnaire, interaction observation, and measuring physical signs. Through questionnaire, um, by answering a written question about anxiousness, physical health, and lifestyle that involving drugs and alcohol, the doctor can measure and diagnose a variety of anxiety disorder and can determine appropriate treatment to the athlete. Um, in interaction observation, observing a change in athletes' social life and interaction could be a way to evaluate and measure level of anxiety. People who suffer from some form of anxiety, such as social anxiety and other, will be less socialized and will cut themselves off from the other people as part effect of their illness. Lastly, measuring physical signs. Anxiety level can also be evaluated through physical signs. Stress, depression, and anxiety disorder can cause stress to the body as well as the mind. Athletes who are anxious may be likely to have high blood pressure and spikes in blood glucose readings. Their heart may beat faster in response to the anxiety and their muscles may feel tight and tense in reflection of their emotional tense. That's all. Next, we move to the next slide.
Okay, now I would like to continue this presentation with the mood level. What is mood? What is mood? Mood is an affective state. It is contrast to emotion or feeling. Mood are less specific, less intense, and less likely to be provoked or instantiated by a particular stimulus or event. Next slide. So there are uh, three type of method that we can use to evaluate our mood level. First one is the clinical interview. Second, self-report inventory. And third is a projective test. The common used by the psychologists is the clinical and the self-report inventory. So we move to the next slide. Okay, what is clinical interview? A clinical interview is a dialogue between psychologist and patient that is designed to help the psychologist diagnose and plan the treatment for the patient. It is often called as a conversation with a purpose. In the clinical interview, there are two types of clinical interview. First one is a intake interview. The intake interview happen the first time someone comes to see the psychologist. This is the interview where the psychologist asks what brings them here, what their mental, uh, and physical health history is, and what they would like to get out of their time with psychologists. So the example of the question such as what process do you follow in assessing a rehabilitating athlete? So this question can test the candidate's ability to effectively identify the athlete's weaknesses. The second method is a mental status exam. This is the clinical interview that looks at more than just the answer to the question. Psychologists can look at the patient behavior, appearance, attitude, and the movement, as well as their answer to the question. All of these things will give a good view of what their mental health is like. So the second method is a self-report inventory. A self-report inventory is a type of psychological test often used in a personality assessment. This type of test is often presented in a paper and a pencil format or may even be administered on a computer. A typical self-report inventory presents a number of questions or statements that may or may not describe certain qualities or characteristics of the test subject. Even the fun quizzes that we often see shared on the social media, it is example of the self-report inventories. While this is an example of this inventory being used in an informal and entertaining way. So the last method is a projective test. A projective test is a type of personality test in which is offered a response to ambiguous scenes, words, or image. The goal of such test is to uncover the hidden conflicts or emotion that they project onto the test with the hope that this issue can be addressed through the psychotherapy or other appropriate treatments. That's all for me. So thank you.
Thank you, Madam Hasniza. That's all from us. Assalamualaikum. Bye-bye. Siapa jadi teacher? Sana.